Hey guys, Dr. McClimon here with McClimon Chiropractic, the Spinal Hygiene guy. And today we're going to talk about how chiropractic helps to eliminate low back pain. Okay, about today, almost 80% of people will suffer with low back pain at some point in their life. That's almost everyone. So you can kind of count on the fact that at some point, if you haven't had it, you will have low back pain. If you have it right now, you know how it ruins your life. You can't work, you can't play, you can't do the things you want to do, play with your kids, your grandkids, do all the things you like, and live the life that you love. So our goal is to help you and teach you not only how to eliminate low back pain, but how to prevent low back pain. And guys, listen, this is the biggest thing you're going to learn. Health is not how you feel, it's how you function, okay? And part of the reason we have low back pain, we have to eliminate low back pain, is because we never did the things we need to do to help prevent it in the first place. Okay, so we're going to teach you some of that. We're going to teach you this concept, guys. Who goes to the dentist? Do you go to the dentist only when your teeth hurt, or do you go to the dentist to maintain good dental hygiene? You go there to maintain good dental hygiene. You don't only brush your teeth when they hurt. If you did that, what would happen? You'd have a lot of cavities probably, right? Well, guess what? Just like dental hygiene, we promote spinal hygiene. So we're going to walk through the process of how we eliminate low back pain and also how we can prevent it from happening in the first place. So as you guys walk in the office, this is the front desk. You're going to check in here. We'll get your paperwork, thorough history. If you have any insurance, we'll check that. We work with most insurances. So you check in here with our awesome CA Marcella, and then you'll come back, okay? We're going to give you a tour as we walk back here. We tell you how we do have an open adjustment setting. It's good for flow purposes, also good for educational purposes. We focus on teaching patients not only how to get well, but how to stay well. Over here, we have a picture of an x-ray of the neck, okay? So this shows you how we focus on correcting the spine. You can see a before picture of the neck and after picture of the neck. Better structure here. This is after about 12 months. Better structure in the spine helps to prevent nerve pressure, okay? Which helps to also prevent degeneration and wear and tear in the spine. You guys have low back pain often because of a condition called subluxation. Okay, subluxation is when the bones of the spine shift out of the normal position. They put dangerous pressure on the nerves. That creates dysfunction in the body and dis-ease in the body. So we focus on finding those subluxation, making specific adjustments to correct those subluxations, which actually addresses the root cause of the problem instead of just masking the symptom with a drug or a medicine or an injection, okay? We do see a lot of kids and families in the office for that reason. Over here we have our kids corner. We focus on spinal hygiene, as I said. Spinal hygiene is, again, just like dental hygiene, we promote spinal hygiene. The spine is what houses the nervous system that runs every function of your body. The healthier the spine is, the healthier we are. The sicker the spine is, the sicker we are. Over here we have a drug jug, okay? The drug jug, patients often come in, take different medications for symptoms, conditions as we improve function. Chiropractic patients take about 85% less medication. How cool is that, right? People are often scared of chiropractic. Guys, hundreds of thousands of people die a year from properly prescribed medications. Nobody dies from an adjustment. So trust me, chiropractic is not only the safest, it's the most effective way to help and eliminate not only low back pain, but create better function. Okay, so over here we also have cervical traction. Okay, so cervical traction is something a lot of people do today to help maintain the proper curve in the neck called the arc of life. The neck is 7 times stronger with that curve in there, but with technology, devices, computers, it's really stressful, not only on the back, but on the neck. So cervical bowling helps to restore that along with adjustments, okay? As we come back here, we're gonna go into our consultation and exam. This is where we'll walk in. We will look specifically at your history, at your specific concerns, this one being low back pain as an example, and how we can gather that information to better help and treat you specifically. So in here, we'll come in here. One thing I wanna point out here, guys, we show this to all patients, and that is the Spinal Nerve Chart. Okay, this is something that most people cannot take their eyes off once they see it, but this is the electrical panel of your body. Okay, these are all the nerves as they come out, different effects that occur depending on where there's pressure. There's pressure on C1, that causes headaches. Low back is down here. Okay, low back could affect constipation, bladder, sciatica, circulation. Okay, not to mention the things you feel, it affects a lot of things you don't feel. The middle part of the back affects a lot of your organs, your heart, your lungs, your liver, your kidneys, those type of things. We always tell patients it's not so much your neck pain or your back pain that's as important as it is also creating dysfunction and disease to different organ cells and tissues in the body. Okay, so improving that structure helps improve the function, helps eliminate the pain. It also maximizes complete function of the body. So we do your consult here, we do an exam, we check range of motion, maybe any orthopedic tests that need to be done specifically with your concern. From there, then we come back. We always take x-rays, guys, to see is to know, not to see as a guess. We don't guess with your health. So we come back here. It's a great way to not only see specifically where the problem is, it's also a great way to screen for pathologies and contraindications to adjust. So the x-ray room's back here. In here is where we do the x-rays, okay, guys? We have digital x-ray, so it's highly specified and scientific, and the latest and greatest that we have in x-ray today. So take the pictures here, we get those instantly. They pop up on the screen here. Okay. Let's just pop one up here. So it looks like this. They'll pop up there. Once we pull up the x-rays here, they actually come over here into the report of findings room. After we do your consult, your exam, and your x-rays, that's day one. Day two, you come back and we actually sit down one-on-one with the doctor, and we go over specifically your concern and how we can help you to correct that, improve that, how long it's going to take, how often you have to come in, and what it will cost. Okay, so this is the report of findings room. We do that in here. We'll bring up your films here. We'll discuss some really valuable and important information to help educate you on your problem and how we can help you to eliminate that. But not only to help eliminate the symptoms you have, but to restore function. Because guys, like, not only do we want to get you back to doing the things in life that you love to do with your family and your friends, but we want to teach you how to live a healthier life naturally. Okay, so report of findings here. We go over all that information, how often, how long you have to come in, what it will cost. If you do have insurance, again, we'll help. We'll verify that and let you know how they may or may not participate and give you a recommendation of care. Once we do the recommendation of care, guys, we head up front and we'll do what's called the adjustment. Okay, so here is a little model of the spine. Okay, in the spine, this is your spine. The bones of the spine can shift out of the normal position. When that happens, it puts pressure on this nerve. That's called subluxation. When that happens in the lower back, it can give you low back pain. So if the spine shifts out of place and puts pressure on a nerve, if you take a medicine, is it going to remove that? If you eat healthy, is it going to remove that? If you exercise, is it going to remove that? If you do therapy, is it going to remove that? The only thing that's going to remove subluxation is a specific adjustment to address the root cause of the problem. Subluxation, which causes nerve pressure, which causes back pain, is a mechanical problem. If you treat a mechanical problem with a chemical solution, you're not going to have a good result. You have to treat a mechanical problem with a mechanical solution, which is the adjustment, which is what we do, which gets us awesome results. We've been doing this for over 20 years, getting amazing results to remove low back pain and improving quality of life. So that's what we do here. Once we go over what we found here, like I said, we'll come up front and we'll actually do an adjustment on our adjustment table. Once we do the adjustment in the adjustment table up front here, guys, that will be the end of your second day. And then from there, you would finish up with your adjustment schedule with Marcella. Day two, then you would come back. We would do, we would give you some homework, some home exercises, some home spinal hygiene exercises, which also help support the adjustments that we do in the office. So guys, look, listen, if you want to get rid of low back pain and eliminate low back pain for good, you can't keep masking the problem with a chemical or a therapy. You have to address the root cause of the problem. That's why chiropractic is so successful in eliminating low back pain. We actually address the root cause of the problem instead of just masking the symptom. So guys, if you have a problem, you have low back pain, or hey, you just want to maintain a healthy spine, just like healthy teeth, we see tons of kids and families and prevent it from happening in the first place. So if you have low back pain, great, we can help you. If you don't have low back pain, statistically, you're probably going to at some point, so that's why you want to take care of your spine to prevent that from happening, and we're a great place to do that. So McClimonChiropractic.com, you can find us there. You can reach our 610-582-4400 is our number. But reach out to us, and I'm sure we can help you.